Hello friends, today we will discuss about pacemaker potential. In the previous lecture, we have discussed about the action potential in a cardiac muscle, but today we will discuss about the same electrical changes or the action potential in the pacemaker. Okay, hope you know what is the pacemaker. So, just I will draw a line diagram of the heart to differentiate between these two types of the muscle, just a rough line diagram. So, as you know, there are 4 chambers in the heart muscle. Okay, 2 atria, that is the right atrium and the left atrium, and 2 ventricles. Okay, this is just a rough line diagram. Okay, so this is right ventricle and left ventricle. So we have discussed about the electrical activity or the action potential in this atrial muscle as the ventricular muscle, but today we will discuss what is the electrical activity seen in case of this pacemaker or the SAnode. Okay, the similar type of electrical activity is also seen in the AV node, only the difference is the production of the impulse is at a slower rate in the AV node as compared to the NA node. Okay, we will discuss about the conducting pathway in the next video. Right now, just electrical activity in this SA node. Okay, now consider this cell as the SA nodal cell. Okay, that is the pacemaker cell in the SA node. So, what type of electrical activity it is seen? So, as you know, all the muscles in the cells, all the cells, okay, in our body, they will have some potential difference across the cell membrane at the resting condition. It is known as resting membrane potential. For example, in the cardiac muscle, which we have discussed, it was minus 90 millivolt. But here in this muscle, it is in this SA nodal cell, it will be around minus 60 millivolt to minus 55 millivolt. Okay, it is not stable, it will be moving. Okay, why it will be moving, why it is not stable, we will discuss now. So, I will just draw a graph to make the point more clear. So, see, on x axis, that is the time period, on x axis, that is the time in millisecond, and on y axis, that is the potential difference in the millivolt, right. Now, it is around minus 60 millivolt, minus 60, this is around minus 50, minus 40 millivolt, minus 40 millivolt is a threshold, then up to 0, then plus 5, plus 10 millivolt, whatever. Okay. Now, at the resting condition, the potential difference will be from minus 60 millivolt to minus 55 millivolt. Okay, it is not stable. It is not stable. That is, there will be no true resting point potential like cardiac muscle. Cardiac muscle, let atria and ventricular muscle, it was minus 90 millivolt if you remember, and we got a typical graph like this. Okay, typical graph like this, that is 0 phase 1, plateau phase 2 and 3 and 4. Okay, those who have not seen that lecture video, please go back to our playlist of subject physiology or the cardiovascular system. In that we can see the detailed discussion of the cardiac action potential. Okay, that was in the normal atrial muscle, that is the muscles which are present here in the atria and the ventricles. Now, we are discussing the electrical activity in the SA node. So, in the SA node, instead of minus 20 millivolt, instead of getting this type of electrical activity, what graph we get? Let us trace the graph. So, why actually there will be a resting moment potential in any cell? Okay, like any other cell, the most important thing here is the sodium potassium pump. Okay, sodium potassium pump. So, sodium potassium pump generally what it will do is it will take 3 sodium ions outside this cell, from interior to outside. It is an active transport, and in return only 2 potassium, okay, from outside to inside. Okay, so there is a net loss of 1 positive charge whenever there is a pumping of this. Okay, and then one more important feature is because of the leakiness to the potassium channels. So, potassium ions will go outside because of leaky potassium channels. So, ultimately it will be negative, that is the total charges will be in the negative here in the interior as compared to the exterior. Okay, how much negative? Minus 60, and it is minus 90 in cardiac muscle, other cardiac atria and ventricular muscle cell. Now, one speciality of this particular SA node is it has the uh, leaky sodium channels. So, continuously sodium will be coming inside from outside, as the concentration of the sodium is outside is more as compared to inside, and due to the concentration gradient also the electrical gradient leaky. So, continuously the sodium will be flowing inside, and this minus 60 millivolt, that is the negativity, will try to tend it to become positive. Leaky in a small amount, it is minus 60 to minus 55 millivolt. Okay, there is always a fluctuation, never at this stable because of this leaky sodium channels. That is why the name given is funny sodium channels. Even this sodium channels, it is called as leaky sodium channels or the funny sodium channels, not the voltage gated sodium channels. Okay, mind it, voltage gated sodium channels which are present in general cardiac muscle, which will open and cause the depolarization. So here it is permanently closed. Why means because it will be open when it threshold level of minus 70 millivolt, but at the resting condition itself here it is minus 60 millivolts. There is no chance of attaining this and opening the sodium voltage gated sodium channels. So for the voltage gated sodium channels are closed, only this leaky sodium channels are there, and it will causes this moving, that is resting potential is not stable from minus 60 to minus 50 millivolt, and the cause is because of this sodium channels and known as leaky sodium channels or funny sodium channels. Hope it is clear. Now, simultaneously after that there is opening of the transient calcium channels, even the calcium channels which are called as T type, that will open, and the interior will tend to become positive up to minus 40 millivolt. Up to minus 40 millivolt, that is called as threshold. Once it reaches the minus 40 millivolt, then there is opening of the voltage gated calcium channels. So calcium from outside will enter inside. Okay, then further there is positivity inside the cell, and the cell will become positive, that is minus 40 to minus 30, 20 up to 0 up to plus 5. Okay, now this phase is called as depolarization phase, that is the action potential, and it is due to what? Opening of the calcium channels, that is the L type calcium channels, opening of the L type calcium channels, depolarization phase. Okay, L type calcium channels. Remember, the action potential in other cardiac muscle, this depolarization phase is due to opening of the voltage gated sodium channels at minus 70 millivolt, but here it is minus 40 millivolt calcium channels. Okay, then after that, when the calcium channels this closes, then there is opening of potassium channels, and the potassium from inside will move outside. Okay, and it will causes the repolarization, that is from depolarization the muscle it will become repolarized, that is because of the opening of the potassium channels. This is called as repolarization phase, and further it causes hyperpolarization to come at minus 60 millivolt. Okay, to attain the minus 60 millivolt. Once it reaches the minus 60 millivolt, again due to all these factors, sodium potassium pump, leaky potassium channels, and mainly the funny sodium channels or the leaky sodium channels, the resting membrane potential become unstable and it will move like this. Okay, now this part, that is initial part by the leaky sodium channels and the later part by the transient calcium channels, this potential it is simply called as pre-potential, that is before the real action potential in the SAnode, it is called as pre-potential or also known as pacemaker potential. Okay, pre-potential or pacemaker potential. So what is pacemaker potential? Now this membrane potential in the SAnode, because of the initial part is due to leaky sodium channels, later it is due to opening of the transient calcium channels, and L type calcium channels opening, that is voltage gated calcium channels, it is due to, it will cause depolarization. Now see, after that similar wave will go on, and similarly there is opening of the potassium channels, and again further it will go. Okay, now the duration between this, it will be around 0.8 second, it is 1 cardiac cycle. It will stimulate the neighboring atrial cell. Okay, how it stimulates the neighboring atrial cell, let me show you with the help of a diagram. Now consider this as a SAnode, a cell in the SAnode. Now it is attached to the neighboring atrial cells of the myocardium, that is the atrial cell, normal atrial cell, right? Now how they are connected to each other? By connexons, that is the gap junctions. Okay, there are gap junctions. Hope you know this cell junctions. Even we have the videos of the cell junctions, in that we have explained about this gap junctions and desmosomes. So basically these two cells in the cell, in the atrial muscles or the ventricular muscle, or even the junction at the SAnode and AV node. So they are connected by the gap junctions, also by the desmosomes. So these desmosomes plus gap junctions together, they form the intercalated disc, okay, which we see under the microscope. Anyway, so this is the SAnodal cell, this is the neighboring atrial cell. How the electrical activity that is from this SAnode is transmitted to the atrial cell. So in the SAnode, just now we have discussed, the electrical activity will be in the form of this pre-potential, then the action potential. Okay, so electrical activity in this SAnode will be in the form of pre-potential, then we have the action potential, depolarization, and then again repolarization and hyperpolarization, again pre-potential. Similarly, then you know the reason why it is. Okay, we have already discussed in detail just now. So this is how. Now Whenever there is a depolarization due to the opening of the calcium channels, what will get calcium channels, this calcium which is entering here will causes the leakage here. Okay, the calcium which is entering here through the gap junctions, it will go to the neighboring cell. This calcium will go to the neighboring cell, and because of this calcium, the neighboring cell will be at the resting membrane potential of minus 90 millivolt. Okay, so when this calcium enters here from this neighboring pacemaker cell, that is the positive charges which will enter here, it tends to become this resting membrane potential from minus 90 to minus 70 millivolt. Then depolarization, repolarization occurs, and you get a graph like this, action potential, which we have discussed in detail, phase 0, 1, 2, 3 and 4. Okay. So, that is in the atrial muscle. Okay. Again, the same electrical activity, it is transmitted to the further neighboring cell, next atrial cell, which was again at the resting membrane potential of minus 90 millivolt. When the sodium channels open, when there is a depolarization and this one plateau phase and all, that depolarization sodium channels will causes the conversion of this resting potential to minus 90 millivolt. Again there will be action potential in this. So, this is how from gap junctions the cardiac impulse is, that is the electrical activity from one cell, it is transmitted to the neighboring cells. Okay, and this is how the SAnode, when it fires the electrical activity, the same electrical activity is transmitted to the various part of the atria. So, atria acts as a syncytium. Okay, but this atrial muscle and ventricular muscle is separated by a fibrous ring. So, it acts as an insulator, that electrical activity can't be transmitted to the ventricle, but the same electrical activity which was initiated by the SAnode is transmitted by the conducting system, that is the AV node and the AV bundle, that is the bundle office, and through its right and left branch by to the Purkinje fibers. We will discuss about this origin and conduction of the cardiac impulse. Right now, remember that the same electrical activity which will transmit to the atrium, then there is a delay in the AV node, and it is a delay of around 1/6 of this second. That is when the atria contract. Okay, at that time these ventricles are not contracting. It will, the contraction of the atria precedes around 1/6 of second. After that, when it is relaxing, then it will contract. Okay, then it will contract and the blood is pumped. Okay, we will discuss about all the things in the properties of the cardiac muscle. Just stay tuned with us. So, right now, just to revise what we have studied today, we have discussed about the electrical activity in the SAnode, and more importantly this pre-potential and pacemaker potential. The initial part of this is formed by the leaky sodium channels, or the funny sodium channels. Then the later part of this pacemaker potential by the transient calcium channels. Then once it attains a threshold of minus 40 millivolt, there is a depolarization by the opening of the voltage gated calcium channel, that is known as L type calcium channels. Then there is a depolarization by the opening of the potassium channels. Again this continues for the next impulse, and your SAnode, this property is known as autorhythmicity. Okay, we are learning the autorhythmicity, the one of the property of the cardiac muscle. So, autorhythmicity or just automaticity is due to this pacemaker potential. Continuously your heart will be beating and the impulses are generating from the SAnode. This is one of the property of the cardiac muscle, that is automaticity, is mainly due to this pacemaker. Okay, hope you like our video. Please subscribe the channel and share it with your friends. Thank you.